Hi, everyone. Welcome back to another episode of Heart to Heart. As you know, this is a series that my partner, Dr. Ambreen Mohammed, and myself, Dr. Amita Gupta, started to talk to today's physicians about their journeys through medicine. Today, we're ecstatic to have Dr. Amita Kundra. Dr. Kundra is our first board-certified cardiac anesthesiologist to be on Heart to Heart. Dr. Kundra completed her anesthesiology residency, followed by her cardiac anesthesiology fellowship, and she's currently in a private practice institution. Her interests include investigating anesthesia technology to improve patient care, and she's very active in several medical organizations, including Women in Anesthesiology and American Medical Women Association. She's a researcher, consultant, and writer, and she's been featured in several publications, including Glamour Magazine and Pop Sugar, and she has a huge presence on social media. So go follow her on Instagram at Amita Kundra, MD. Dr. Kundra, thank you so much for joining us today.
Oh, thank you for having me, guys, and thanks for the intro.
Yeah, of course. So, just to get started here, Amita, we'd like to ask all of our guests about really what got them interested in their field, especially since sometimes, certain specialties can be intimidating to students and trainees. So tell us a little bit about your journey and how you got into cardiac anesthesiology.
I actually just kind of fell into it. So I was in residency and I did my cardiac rotation pretty early on as an anesthesia resident. And I just kind of fell into it. It was interesting because it was a very difficult rotation for me, very sick patients, complex cases, learning the physiology, and then also just the management of those cases can be challenging. But I think the fact that I did it early, I started to take an interest in it. And then it kind of I spoke to my program director and he was like, oh, you should think about cardiac. And I was like, oh, I never really thought about it. And I think one of the key reasons why I ended up doing it was because I had great mentors. It's it's a very male dominated field. And I didn't realize that until later on, but I was fortunate enough to have many female mentors during my training. And so I decided to do a fellowship, and I don't really regret it at all. I think it was a great training. I think it allows you to manage complex cases. It just kind of gave me like another, a sense of self-confidence in terms of managing any cases that come my way, any sort of cardiomyopathies, any sort of cardiac conditions. And I think that's really like one of the cruxes of anesthesiology is being able to understand the physiology and being able to manage them well. So yeah, that's kind of how it all happened.
Yeah, I will say, obviously as cardiologists, and Brina and I love physiology, but anesthesiologists, it's a whole nother level because on top of, the pathology and the underlying physiology, then you're adding certain conditions, right? On top of these underlying conditions, like anesthetics and surgeries. And so you guys are the experts in that, and we bow down to that. So, I do think that it's important, like you said, for these opportunities to be given to females and people, in diverse backgrounds. And like you said, you had a program director and mentors that helped open up those doors for you. So, and I really think that's important. And it's nice to hear that sometimes you don't know what you're good at until somebody says, hey, you did really good with that. Maybe you should look into it. So it's nice to hear that from you as well.
Yeah, I'm very grateful for that. I think that, we also aren't always in tune to that. I think as females, we're always very self-critical of ourselves and the work we do. And it was nice to receive positive feedback. And it was also nice to, I guess, to have someone who I could see being in their shoes. Like as a female, she actually was Indian, but, I don't think it would have mattered really. But, she kind of became like my second mom when I was in residency and fellowship. So I was fortunate enough to really have her guidance, but also in terms of, I think, like developing your own personality and your own voice. I talk a lot about that on social media. And I just think in very male dominated fields, we are kind of navigating the system. And I think we have to find our voice. And I think I had someone who I kind of realized, oh, I want to be like her, when I when I start practicing. So yeah, I was fortunate to have all that around me.
Absolutely. And, like Amisha and you have pointed out, it's really important to have great mentors. And I remember in fellowship, I had the same, I had a very unique fellowship experience in that I had a lot of females and a lot of people of, different backgrounds in my fellowship, which most people, and especially in adult cardiology, don't have.
Yeah,
It's usually
right.
very male dominated and very towards one race, and we can always talk about that kind of stuff later, but and it really impacts your career. And I remember early on in residency I was told that cardiology is probably not the best field for you. You need to think about raising a family. What about getting married? What about having kids? And I really wish it was more of a supportive thing, and I'm sure that all of us at some point have heard comments like this, and it's really unfortunate that that still exists in this day and age. You had mentioned a little bit about your, social media presence and how you really advocate for women. And you're obviously very active with the American Medical Women's Association, and you're a part of a lot of these organizations with women in anesthesiology. So what particular difficulties have you had to encounter as a woman in your field, and what do you think needs to be done to promote more women and people of different backgrounds in pursuing medical careers in general, but really also in anesthesiology and a subspecialty like yours, which you mentioned is predominantly male dominated?
Yeah, I mean, I think there's so many things challenges I faced. I mean, in terms of not being heard, not being respected as a female, having to speak to a male colleague to really have their back in order to have, I guess, to support me in order so that my voice was heard. And, I think it's taken me a long time to kind of realize, to find my voice and also find the confidence and understand the way that dynamic works. I'm fortunate that I don't have that as much anymore. Don't have those challenges as much anymore, because I think I've just been practicing for long enough and I've realized that, how to get my point across. So I think that's probably one of the biggest challenges I've faced. I mean, in terms of dismantling, there's a lot of gender biases and even racial bias that exists in medicine. And I think one of the main ways we can fight these biases is by sponsorship, by putting women in leadership positions. I mean, by having a woman as a chairwoman, a woman as a vice chair, a woman as a CMO of a hospital. I mean, it really means a lot. It just shows that, yes, there can be a woman there. I mean, women's needs will be more heard and more understood as well. So I think that's super important. We're starting to see that more in all specialties, also in my specialty. So I think that's what's been super important to me. And that's also why I've decided to continue to stay in my societies and be active and contribute in any way I can, because I do want to make it easier for the future generation. And it's sad that even in this day and age that we're still fighting these challenges. I mean, like just basic things is there kind of the reason why I've decided to continue to post on social media.
Mhm.
So.
Yeah, absolutely. Like you said, I think we all feel, at least our generation feels that sense of responsibility. And I think we've all found our voice in some way, whether that is in the institutional setting, on media platforms, or with each other. I do think that we're starting to, break down some of those stereotypes by at least having those conversations. And you are very candid on your social media platform about your personal journey, as well as your medical journey. And you've obviously shared on social media, on Instagram, but you've also engaged with different media outlets about what's important and important conversations that are being had in public health and in our medical communities. And so, how do you feel social media and these media outlets have helped you from a career perspective and also from a personal perspective?
I think from a personal perspective, it's just actually allowed me to heal, going through IVF and, loss and all those things that I went through in the past few years. I think kind of it was like therapy for me, and it also helped me find a community of people who understand. It's given me like best friends, and like people I basically call sisters. I've met people who are doctors who are going through IVF.
Mhm.
And I've become very candid about it just because I know that there's so many people that are suffering and that are silent. um, and I think from a career perspective, it's allowed me to find people that are actually very supportive of me. I think that has meant a lot to me. I think it's allowed me to become more involved in our medical societies and allowed me to kind of work with the groups to address these issues. We still have issues of, it's like our IVF coverage for IVF, like women suffer, 1 in 3 women in medicine are believed to struggle with infertility. And the majority of us have to pay out of pocket for IVF coverage. And, that's something that I really am trying to fight. And then in addition, like even in terms of like support to women and mothers, like, our breastfeeding policies, for example, in many cases are abysmal. So I think things like that, by me sharing my issues, I've kind of been able to find a community for myself that understands and also wants to dismantle, these struggles that we go through.
So important, right? Because a lot of times I feel like when we're going through our own personal struggles, it's incredibly isolating. And I know that Amisha and I have talked a lot about this before, that before we joined the public aspect of social media, there's a lot of stuff that we went through in our own careers and faced a lot of imposter syndrome and other types of struggles that we've had to face personally as well, that when we joined social media, I don't think we realized what kind of community we were going to be engaging with. And it's been incredibly uplifting to find like-minded people to relate to. And honestly, seeing others share their journey with IVF and having difficulties with pregnancies, that's incredibly it's inspiring to people like us. I mean, Amisha and I both don't have children, but I mean, if it ever comes to the case and we do have difficulties, I mean, we look up to people like you who were so candid to share their journey and just show us that it's possible, anything is possible. And so we really appreciate that, because that is a really hard thing to do. Women have to already go through so much, especially when they're in the medical field, and then to have to go through this additional journey, which is a whole nother thing, can be extremely burdensome and can cause a lot of, can be emotionally taxing, right? So for you to be brave enough to share that, and then I'm sure find encouragement from others is very fulfilling.
Well, that's sweet of you guys to say. I mean, I think that it really I'm lucky because I had women before me who were candid about their journey, like Anita Patel, who's one of my good friends now. And, she kind of inspired me to share my journey. So, I guess I'm passing it on, like a lot of people have been candid with me about their journey as a result of, sharing my journey, but I feel like it just makes us all stronger. So yeah, and I'm sure you guys have passed on so much to the people below you as well. So it's nice.
We hope so. We hope so.
I think so.
So one last question for you. So what advice, and this is a question we typically don't ask, but what advice would you give to your younger self? And what advice do you have for those that are seeking to learn more about your field?
I think that, one piece of advice I have is to stop being so critical of yourself, and stop self-doubting yourself. I think that that's like a big struggle that we go through as women, and especially in medicine, where we're in a very tough field, challenging both mentally, physically, and emotionally. I think that women tend to be self-critical of themselves. And then in terms of people that want to learn more about my field, I think that, having a mentor is important. There's a lot of great mentorship programs that are being started. So reaching out to people on social media, in terms of whether you're interested in shadowing them, if you're interested in just learning more about the field, I think that there's just like social media is a great resource for that. And then also just asking around, like, don't be afraid to ask, your primary care doctor if they know an anesthesiologist that may be interested in letting them shadow them. There's a lot of opportunities out there, whether it's from volunteering to, shadowing. So yeah, if you really want it, just go after it,
I think that's really, really, really great advice. So we're so happy that you took out the time on a Friday to be with us today. And do you have any lasting words for our audience before we go?
No. I mean, you can always follow me to learn more. I'm always, if anyone has any questions, feel free to reach out to me. I will be actually I'm starting a YouTube channel. So, I hope to share a little bit more. I know I'm joining the YouTube train. So yeah, I know it'll be fun. So if you guys want to learn more about the field and learn about the future of healthcare, just let me know.
Awesome. We're so happy again that you were able to join us today. And again, if you have any questions, you can always reach out to us or reach out to her on Instagram and follow our YouTube channels or more YouTube channels, and we'll all learn together.
Yes.
Thank you, everyone.
Thank you for having me.
Of course. Thank you, everyone, again for joining us on Heart to Heart. And we'll see you guys next time. Bye.